Hello and welcome to this episode of Ask Amy. Today we're talking about medical bills, and one fee in particular that I started hearing from a lot of you about are facility fees. So we brought in an expert today to talk about facility fees with us. This is Vivian Ho. She's with Rice University's Baker Institute. She is the chair in health economics and a professor for Baylor College of Medicine. Thank you so much for joining us today.
Thank you, Amy. It's a pleasure.
Yeah, so you've known about facility fees for probably far longer than the average patient consumer. First, can you tell us what are they? What are facility fees?
Facility fees are fees that were normally charged by hospitals to cover the extra cost of running a large, complicated healthcare system. So when you have to have CAT scans, MRIs, all sorts of facilities available to take care of very sick patients, hospitals are allowed to charge a facility fee in addition to the other care, just of, for example, the doctor who's coming to see you.
So that makes sense. Like when I go to a hospital, if anybody's ever been to the hospital, you know you usually get multiple bills when it's all said and done, right? You might get a bill from a doctor, you might get this bill from the hospital that covers the supplies and the actual hospital. Is that what we're talking about?
Absolutely. So if you go to a hospital for either outpatient surgery or an overnight stay, you're going to get professional fees being charged for the physician's care, and then you're going to get a facility fee in addition to that.
So in hospitals, nobody ever really questioned that, because we know when you go to a hospital, that stay is going to be a lot more expensive than when you go down the street to see your regular doctor who you normally see for routine care. But then you noticed facility fees pop up. What was it during, not even during COVID, even before that, with these freestanding ERs? What can you tell us about
absolutely. I started learning about facility fees when we started getting freestanding emergency departments in Houston. Mm-hmm. And so it's something that patients will remember as surprise bills. So you would see a freestanding emergency department in a strip mall, and you would think, oh, this is typical to a normal doctor's clinic that I would go to, except it's open 24 hours a day and it's midnight and I've got a major cut. I need to get stitches, so I'm going to walk in here. And you go home and you think you're going to get a bill maybe for a few $100s, and then all of a sudden there's a facility fee tacked onto it, easily over $1,000.
Yeah, yikes. I remember that in the early days, because I think a lot of us, myself included, thought of that ER, freestanding ER, as the same thing as like an urgent care. And
exactly.
And then, no, it's not the same thing if you go there. So basically what we did in that is, I feel like everyone, yourself, news reporters, had to educate the public. And when you see that emergency room sign, you are paying emergency room prices, just as you would if you went into a normal traditional emergency room.
Exactly. The key is to look for the word emergency. If it's there, you are going to be paying, and you're going to be charged the same fee as you would if you walked into a hospital emergency room.
Then during COVID, we also saw some of these facility fees, and I don't know if I'm sure you recall this, but a lot of people were doing the drive-through COVID tests and shots, and you would not even get out of your car, you would drive through, and then we started hearing from people about, wow, I just drove through and I happened to notice that they billed my insurance like hundreds of dollars, or sometimes even thousands.
Absolutely, because it's hard to see when you're driving through exactly what is it that I'm walking, and you think, because it's just a test, that, oh, it's an exception. But this was a ploy, unfortunately, to take advantage of that, being able to charge that facilities fee, particularly if these facilities were out of network for any major insurance companies, so they had the freedom to charge whatever price they could.
So was that, and they could charge the facility fee because in some way these drive-through clinics were hosted by or put
Absolutely.
on by hospitals?
Well, okay, not necessarily. With freestanding emergency departments, some were not actually hosted by a hospital. It was business owners who got themselves licensed as freestanding emergency departments by the state.
Got it.
And if you could use that term, you're not necessarily a hospital, and you're charging these facility fees anyways, which you should be wondering about. Why is that the case? If you don't have any of those additional costs of running a hospital, why should you be allowed to do that?
Right. And so I know that there was some legislation within the state of Texas that covered some of that. Like if you're just driving through, if there's no sort of hospital affiliation, if you're not getting any sort of treatment that you needed to be hospitalized for, you shouldn't be charging those in the state of Texas.
Right. So there is some state legislation, and now you're required, the business owner is required to tell the patient and let them know whether they look at your insurance and say, our facility is in network or out of network. It seems that not all business owners are abiding by that, unfortunately. There was legislation that was proposed to require them to post their prices, which would have been helpful, but that did not make it out of the legislature.
We started hearing from patients and customers this year, and when we shared a story, we wanted to share a small part of that for you, just so that you understand what it looks like for patients, or what it could look like for yourself if you get one of these bills. This is Mindy Easterbrook. She's got 2 children, both with type 1 diabetes, both who have seen the same doctor for years. And then she noticed a big charge that she hadn't seen before. Let's listen to that.
It's absolutely outrageous.
Outrageous new charges that Mindy Easterbrook has never been charged when she takes her 2 children with type 1 diabetes to see their doctor.
They see an amazing doctor there. We absolutely love her. But we're getting charged facility fees now by Texas Children's Hospital on top of our regular doctor fees that were being billed.
Right here in black and white, $405 for what's labeled observation treatment room, and $290 that reads room, staff, and supply charge. And this isn't just an annual visit. Easterbrook's daughter and son check in with their doctor quarterly.
So that's just what it looked like to one parent of kids who had to be seen. And we're seeing it now, those fees that you first noticed on freestanding ERs, now in our normal doctor's offices. What happened?
Well, once the healthcare providers, the large consolidated providers, realized that there were many places they could charge a facility fee. If they acquired a physician practice, they could declare that physician's office as part of the hospital and therefore tack on a facility fee to a normal doctor's visit. And it's becoming, unfortunately, more common, and people actually think that it's driving the consolidation, the motivation for healthcare systems to acquire physician practices.
Yeah, so in her instance, she's a part of Texas Children's Hospital, and the physician that her children go see is a part of Texas Children's Hospital, but Texas Children's just started imposing these fees November 1st. That's what they told me. And so they're like, we don't get it. It's the same service, same place we've always gone, but now they're charging this fee. That's what we're talking about, right?
Right, and it looks nothing like a hospital, which is, where she's taking her child.
What do patients need to know? I mean, is there anything that I, as a patient customer, can do to, I guess, protect myself or know before I go in that, hey, if you go here, you're going to get hit with this fee?
Well, you can actually call up the doctor's office and say, is there a facility fee attached with my visit? And hopefully they'll actually tell you the truth. It would be good if insurers would start informing customers of locations where a facility fee would be charged. That's another helpful part. Or, hopefully we can get some sort of legislation to actually put a stop to cases where facility fees are being charged when they should not be.
Right. That's a great place to take a quick break, because when we come back, I want to talk a little bit about the legislation that was introduced just in Texas that would have protected us here and banned facility fees. We'll be right back, and then we'll talk about that when we come back. Welcome back to this episode of Ask Amy, where we're talking about facility fees. Our guest today is Vivian Ho with Rice University's Baker Institute. She's the chair of health economics. So we were talking about legislation when we left off, and sort of what's being done from the law standpoint, what lawmakers can do. There is some federal legislation sort of pending right now.
Right, it's just passed through the House, but it's after a recommendation by the Medicare Payment Advisory Committee to actually require that these visits that are going on to physicians' offices be charged the same fee as they were before all these shenanigans started up.
Yeah, and even before then, in Texas, one state senator, actually Senator Kelly Hancock up in the Tarrant County, Dallas-Fort Worth area, he introduced Senate Bill 1275 that would have banned facility fees. So we hopped on a quick Zoom with him to ask him to explain it to us. Let's listen to that.
Senator Hancock, could you please tell us the idea behind Senate Bill 1275? If you can kind of just describe what you were hoping to accomplish with that bill.
Yeah, to protect consumers, protect patients from additional charges that just didn't seem to make sense to us.
And how did you hear about those charges? Was it constituents calling your office?
Initially it was from freestanding ER that was charging, for the facility. And then we noticed some of the hospitals were starting to do it. And it really, what it became is a kind of a post-COVID way of improving profits, I guess, just additional charges that took place. Very similar to what we saw when we passed balanced billing. When we passed balanced billing, all of a sudden, because we initially eliminated some of these charges related to, different specialties, and all of a sudden we began to see new charges pop up that were being passed on to consumers. And we just felt like somebody's got to protect the consumer. And so we jumped in there.
And whenever you see these things, I mean, I know that it was introduced in committee, but was there any opportunity to hear any feedback or anything from the hospitals that were assessing these penalties or charging them about, not penalties, that were assessing these fees as to why they were putting them on?
A little bit. It was mostly quiet. It's tough. I think it's a tough thing to answer for the hospitals of why they're doing this. I mean, I'm in the chemical distribution business, and my job's to run my business profitably so that I can pay employees and keep families, food on the table. But I don't really get to charge my customers for a warehouse fee just because I need a warehouse in order to do business. And so, same thing, grocery stores. Grocery stores don't get to charge you after you buy your groceries. Oh, by the way, we want to add this, store fee because we need a store in order to sell you groceries. And so, I get from a business standpoint, wanting to improve profits. I just, especially in healthcare, it's just not much of a free market anymore. You don't get to leave and go somewhere else. So that's why we felt like we kind of needed to step in and offer some protections for those patients and people dealing with it.
But then what? I guess if you might explain the process to people, it gets introduced into committee, and then what is supposed to happen?
Well, hopefully you get a hearing. I mean, 2/3 of the bills filed never pass. I mean, we've been very fortunate. We typically have an 80% plus rate. But once something's filed, then all of a sudden the light's on it. And so those that oppose it kind of come out of the woodworks and find various means to either prevent it from getting a hearing if the truth and the facts are not something they want out, or you get a hearing and all of a sudden you bring light to some of these issues and you start gaining some momentum, which is what we were hoping to do is have the opportunity to let everybody explain, get the facts out on the table, and then let's deal with the facts once they're out all on the table.
Yes. And so do you feel like which one of those things happened? You didn't feel like you got traction. Did you feel like opposition came out of the woodwork?
There was a lot of, there were a lot of woodwork happening in the legislature. There were a lot of termites in the Capitol once that came out.
So the bill didn't go anywhere. It was still in committee when you guys ended the legislative session. So then what happens now? I mean, do you have any plans to bring it back up again?
It's kind of like the property tax reform. When we tried for years to reform property tax, but momentum grew, and no longer could the cities and counties, fight it and win on that. Unfortunately, we brought this up. We know very early, before there was a lot of momentum and people getting bill, we tried to address it very early. I think what happens now is, more and more of these bills go out, more and more customers, constituents get hit with these additional fees. And I think momentum grows that eventually, it took me 10 years to pass balanced billing, get rid of it before the federal government kind of copied what we did in Texas. And I'm pretty persistent, and I don't plan on going anywhere. So, I think we just build momentum based on, like you're doing. Continue. We filed this. We really were moving forward with this 2 years ago. Well, we're doing interview today because people are seeing it more and more, and they're not happy with it. And so I think momentum grows, and we'll continue to be there and continue to pursue protecting patients.
All right, so you heard the senator there who pretty much said that his bill was kind of dead in the water. It never made it out of committee. How much hope is there that they'll pass something at the federal level that would protect everyone nationwide?
Well, we really don't know. It's hard to say because it's an election year, and there are so many different priorities, difficult priorities that Congress is facing right now. I will say this, though. It is a bipartisan issue. There are many people who understand how much this is affecting customers who have commercial insurance. It's extremely difficult. It's upsetting. And if they pass legislation that bans these facility fees for physician office visits, it's going to save Medicare. There are different estimates depending on how the language is written, but you could be saving over $100 million.
Wow. I mean, generally, I was talking to you in a commercial break that is normally how it works, because when the federal government sees how much money they're paying unnecessarily from Medicare patients, then whatever they pass trickles down to everybody else in commercial and private pay.
Absolutely, because commercial negotiated contracts tend to mimic in many ways what Medicare negotiates with healthcare providers. And if anything, though, it would save commercial insurers, and we're not talking about saving insurers money. This saves patients money because the patients are paying the premiums behind this. And it will save them even more because there's no limits. Medicare regulates its prices, it caps them. Because of consolidation in the private sector, prices have gone even higher, so the savings for the customer are even greater.
All right, when we come back, I want to talk with you more about that, about insurance and sort of what's happened in the healthcare marketplace. We'll take a quick break and we'll be right back. Welcome back to Ask Amy. Today, our subject, very important. We're talking about medical billing and facility fees in particular. So we just listened to the state senator talk about a bill that didn't pass. We know that there is something in legislation right now sitting at the Senate. Hopefully that will pass. But I mean, can we talk a little bit about how we got here? We did at the beginning, but we're seeing these fees in doctors' offices when the doctors are not independent practitioners, when they're employees of hospital systems, right?
Right. What happened during COVID, if you were an independent practitioner and during that first part of COVID, everybody stopped going to the doctor. They were so afraid of getting COVID in the doctor's office, they stopped going. So every independent physician suffered just a huge cliff in terms of there was no revenue. And that actually drove an increase in acquisitions. They decided to sell out to, in some cases, larger physician practices, but in many cases, they sold out to hospitals. Mm-hmm. And so during that period, it was the first time we had more than 50% of physicians actually becoming salaried employees as opposed to independent.
Yeah, so the days are fewer and fewer of being able to just go to my sole practitioner. It's just, Dr. Baker or whoever that just has this practice by himself.
Exactly. It's no longer possible. It's a huge amount of paperwork. When you look at a physician, they can't control who's coming through their office. They have to take patients who have multiple different types of insurance and Medicare, and in some cases, if they can take on the Medicaid patients as well. Each one of those insurers has their own set of negotiated rates and paperwork, requirements of reporting, all sorts of things, and it's extremely hard to sort of manage an electronic health record and sort of deal with multiple payers and collect your bills on time.
Yeah, and I mean, so these are physicians, doctors who sort of their entire training and career has been based on helping people get better, but then they're asked to sort of be, business people, right? Yeah, exactly. And that's the part that they don't necessarily like. It takes them away from practicing.
Yeah, they don't like, and then with all of the advancing technology, it's changing on them all the time. It's software and you name it, and then changes in regulations required in terms of what you're gonna. Medicare has made its reporting requirements much more complicated in the last few years. They're trying to move towards pay for performance, but it's costly. It's hard for a sole practitioner to keep up.
Right. We like to always tell people what you can do. I mean, here's the problem. Now here's the resolution. I mean, this one's not that easy.
No, it's not. So. You could be calling your doctor's office and saying, I know I'm scheduled for this visit. Could you tell me whether you charge facility fees for your visits? And hopefully they're honest with you about that. In principle, some of them could, some patients could try and switch to independent practitioners. That takes time as well, and maybe you have an established bond with your current physician and you don't want to do that, so that's difficult as well.
Right, I know from our reporting, some of the hospitals said that you could do a telehealth visit, but with some of these doctors, endocrinologists and some of the specialists, that doesn't always work. I mean, sometimes your child or you may need to actually physically see the doctor, but they said in telehealth visits, they won't apply these facility fees. And so, yeah, it's like, so if you don't go see somebody in person at all, we're not going to charge you those. I also know Texas Children's Hospital was waiving the first, I think just because it's new for them, since these fees in a lot of their doctor's offices, outpatient clinics started, they said that they were waiving, not just across the board, but if you called and complained or called and asked about them, they would waive the facility fees the first time that they were assessed in your case. There's going to be a lot more. And then they also said that, hey, maybe they're just noticing them because this is the first of the year and they still haven't met their deductible. But once they meet that sort of pay out of your own pocket deductible, then your insurance company will pick these up. What's the problem with that, though?
I just find that so disappointing. Patients realize healthcare is complicated and it's complex. And, they are willing to pay more for a service that has higher value. But in this case, providers have just found a different way to collect more money. It is collecting a facility fee where there's no additional value over and above what you were getting before when you were paying just the professional fee. It's just not right. And the example, you're giving of telehealth, my son had strep throat a couple weeks ago. There's no way they're going to test for strep throat on a telehealth visit. And there's so many different visits like that.
And we did ask, Texas Hospital Association did reach out and provided some information that we're sharing online about basically how, oh my gosh, this is going to be detrimental to hospitals in Texas if they ban these fees and we can't collect on those. But I'm like, but if you weren't charging them before and now you're not providing any more different service or more service and you are charging them, where's that extra revenue going?
I don't believe that particular statement. I've been doing a lot of work with the National Academy for State Health Policy, which has been taking Medicare cost reports. They post them on the web, the hospital cost tool that they have. And you can look at the hospital financials for all of these different healthcare systems by year. And what you see are that the healthcare systems that are engaging in this charging facility fees for doctors' offices, that are the largest, the most consolidated, they are making terrific profits. They are financially very healthy. And it's the smaller organizations, rural organizations, that we should be worried about. And they're pretty much not engaging in this practice.
All right, Dr. Vivian Ho, thank you so much for coming in, sharing your wealth of knowledge. This is a topic we want to stay on top of, and of course, we'll follow that legislation and write your representative. I mean, if this is important to you, let your elected leaders know that you don't like these facility fees, or you do. It's up to you. Thanks for joining us for this episode of Ask Amy. Have a great day.